Thank you. Chair recognizes the gentleman from California, Mr. Rohrabacher.
Well, thank you very much, and let me just note that we hear charges all the time from people who claim that we are politicizing science by basically supporting positions that are not acceptable to other people who believe that their positions are sacrosanct, I guess, and should not be questioned. As a young man, I remember very well the whole issue of cyclamates. You fellows remember cyclamates? That was the industry, the soda pop industry had put enormous amounts of money into developing a new sweetener, and it was cyclamates, and they got it into the drinks. Then all of a sudden it was said that cyclamates caused cancer, and they had to pull this out. It cost the equivalent of billions of dollars today when this whole thing, by the time it was finished. And then, of course, cyclamates were pulled out, and then 10 years later, after a study, it was found out that cyclamates did not cause the cancer. And the Canadians had never banned the use of cyclamates during that whole time. So we have to be very careful, because those billions of dollars that were wasted in that particular instance could have been used for something else that was beneficial to us. For example, when the cyclamates were pulled out, I know that what came in was high fructose corn syrup instead, which may not cause cancer, but my wife will not let me have anything that has high fructose corn syrup in it. Now, whether or not that means because she's afraid I'm getting fat or whatever it is, the bottom line is the cyclamates would have been more healthy for me than the high fructose corn syrup. So there is harm done by chemicals, and there's no doubt about that, and we should, and I'm very proud that Ronald Reagan signed this bill. I was working for Ronald Reagan at the time. I may have had something to do with the statement made on this issue years ago, but the harm done by cyclamates, or by chemicals and drugs, we also have to recognize there is a danger to be done by not permitting people to use beneficial chemicals and drugs that have had positive impacts on our lives. And so we have to really be serious about it. And I would hope that the IRIS program is being serious about it and does not succumb to what we have seen here over and over again is a politicalization of science. And it's not a politicalization that comes from, oh, we have to represent some major financial interest, but instead it's a politicalization where once an academe that something, and PhDs, I don't know why they have this inclination, but they've spent their life promoting a particular theory, or they've come out and gotten grants on a particular theory, and they will fight to the death to defend that theory, even as more people come up and say, well, that actually it doesn't fit with what we've newly discovered. And I believe that man-made global warming, the fight in that, people have been denied over and over again. We have seen this for over the years, denied research grants by those who claim to be so open-minded and liberal about this, and they've been denied people if they have any question as to whether or not mankind is causing global warming. So one question, I know we're running out of time here for my question, but we need to make sure that people are looking not just at the specific reaction to chemicals, but also what is the threshold that someone, because we all ingest chemicals, even natural chemicals all the time. Threshold is very important, as well as the frequency of exposure. And are we being cautious enough to making sure that we do not take away the beneficial chemical results and chemical things that chemicals can do for us? Is that issue now being handled correctly by the this program, or is this still a problem? And I just, for the whole panel. Yes, sir.
Thank you for that excellent question. And in fact, it really touches on the issue that Dr. Burke just touched on. The agency is called on many occasions to deal with some very challenging issues, such as events associated with hurricanes. That means that the staff that they have needs to be put in the right place at the right time, and they certainly cannot be diverted to efforts that ultimately are really not proving, as you say, necessary to improving public health. Let me give you a practical example of that. There's a compound that's under review right now by the agency called ethylbenzene. This is an intermediate compound, 99% of which, in terms of its total chemical production, is used as a closed system intermediate for the production of styrene. So it's a closed process. You're not going to have much releases to the environment as the result of that use. The other exposures to ethylbenzene come from its natural component of gasoline, which of course is assessed by other means independent of the ethylbenzene that's contained within it. It's also another very small component of mixed xylenes, which is a commonly used solvents. But again, mixed xylenes are assessed for their own toxic independently. So why is this important? Well, EPA is set off in terms of projecting, and this is as of just a couple of weeks ago, the IRIS program notified that they were going to continue forward with the evaluation of ethylbenzene in terms of developing an IRIS evaluation of it. That's an extensive effort on their part, which will consume staff time. But yet, over a year ago, in a public problem formulation session, which was appropriately held for this compound, they were advised that this compound is a chemical intermediate, all used in closed system production, and that its exposures, which have been monitored in the air across North America for many years, are less than 1 part per billion, which is the general air concentration associated with ethylbenzene. But here's the kicker. In the case of ethylbenzene, in terms of the animal toxicity studies, the primary endpoint of concern is liver tumors in rats that are seen with ethylbenzene, but they occur only at a concentration of 750,000 parts per billion. Now, I would argue when you look at that data set alone, you would say that particular compound might not be worthy of where a significant resource investment by the agency justifies evaluation of a compound for that concern. And that frees the agency up to make the types of information flow that's necessary for the other critical events that they're challenged with dealing with on an everyday basis, as Dr. Burke has already mentioned. So it's just one example that's actually currently in progress today. So it's, again, another example of has the IRIS program truly learned and put into action what its words are versus where it's walking the talk. At least from my perspective, I have some real concerns that that isn't the case. And in the end result of it is just as you've just described. The necessary resources of the agency to truly protect public health, which I believe is exactly what they should be doing, are constrained when they're not making wise decisions as to where best to put their time in terms of evaluating the science.
Thank you, and the gentleman's time has expired.